Hello and welcome. My name is Tim Poe. I'm Director of Telehealth with the UNC Cancer Network. Thank you so much for being here today for our Lunch and Learn lecture on cancer. A few preliminaries before we get started. If you are running into any problems or need to follow up with us regarding technical questions, other questions, you can reach us by email at unccn@unc.edu. You can call or text us anytime at 919-445-1000. We'll be using Poll Everywhere for our questions and answers, and we'll do that both at the beginning of the session and again at the end, and I'll go over that in just a moment. You can find us on the web with all sorts of information, over 150 recordings and lots more at unccn.org. We're on Facebook, we're on Twitter, so find us on the web, and we have lots of great offerings there. We will use Poll Everywhere. If you have a phone that has texting capabilities, you can use that. If you have a computer or some other ability to access a web browser, you can do that as well. For a web browser, you just go to pollev.com/UNCCN as it shows on this page. You can also go ahead and just text the letters UNCCN to the number 22333. So you get out your phone, you'd say, I want to text to 22333, and then you put in the letters UNCCN. Then you'll get a response back. That lets you know that you're connected to our session today, and then you can go ahead and respond to any questions that we have through the presentation. So with that in mind, go ahead and let me go back one. The question that we'd like to start off with today is, how do you define spirituality? So if you would like to respond to that even in just a few words, that would be great, and then we'll look at that in just a minute. So you text to the number 22333, the letters UNCCN, once for today, and then you can go ahead and start texting answers to questions or later questions. And we'll start with, how do you define spirituality? All right, let me jump in here and introduce our guest, Heidi Gessner. Heidi Gessner is an ordained United Church of Christ minister and serves as the palliative care chaplain and bereavement coordinator for the UNC hospitals in Chapel Hill, North Carolina. Heidi provides emotional and spiritual support as well as grief counseling to patients and families and staff. Heidi trains volunteers for the Compassionate Companions program, formerly known as No One Dies Alone, and co-facilitates a weekly writing group, Writing for Resilience, for patients, caregivers, and survivors. Heidi, welcome. Thank you so much for being with us today.
Thanks, Tim.
Tell us, before we get started with the presentation, what drew you to this field?
Well, this field became very important to me when my father experienced cancer. He had lung cancer, terminal lung cancer, in 1994, so over almost 23 years. Before that, it was not an interest at all, but during that time in my father's illness, we experienced such a deep, rich, our relationship just deepened, and I saw a side of my father that I didn't really see growing up. He was a very busy type A businessman and a big list maker and things to do, and he told me that, once he was diagnosed, the only thing on his list was staying alive. And he just really slowed down, and although it was a very hard time, I felt very comforted by just kind of a presence that I can't even explain for the first time in my life. And my dad taught me a lot about living and dying throughout his illness. One quick example is at night when he couldn't sleep because of pain, he wrote letters to all of us in his family and his close friends, thanking them for, what they had meant to him over his life, giving maybe little tidbits of advice, don't change, you're great the way you are. And so every year on the anniversary of his death, I read that letter. Yeah, so it really impacted me in that I wanted to kind of help others, be with others during this very personal, intimate, and tough time in life.
Thank you for that very personal story, and that certainly that certainly provides a perspective on that. With that, let's take a look for a moment at the poll everywhere. So we have in a totally humanist and natural way. Let's see. We're trying something different with a word cloud, and we're having a little trouble seeing some of the other. I'm going to go back to it and see if we can read some of the other ones. We may have to go being connected to a greater power, and then I'm sorry that for some reason I'm not able to see the one behind that.
I don't know.
We can try.
Maybe we
You got it. Good. In a totally humanist and natural way, and then again being connected to a higher power.
Yeah, all great definitions of spirituality. And the one that I will use in this presentation in a few slides actually includes pretty much all of those pieces. And I went with a definition of spirituality by Christina Puhalski, who's an internist at the George Washington University and started GWISH, which is a spirituality program and medicine, spirituality and medicine. And she came up with this definition through a consensus conference about 8 years ago that included physicians, social workers, chaplains, priests, occupational therapists, all kinds of different fields in healthcare. And one of the things they came up with is that spirituality is an individual and personal way of finding meaning and purpose in the world, and the way that people experience that connectedness to themselves, to each other, to the way they relate to the world, to nature, and to the sacred, whatever that is. So kind of all these definitions we see are part of that.
Yeah.
And the difference between spirituality and religion is that spirituality can certainly lead to religion, but religion is sort of less personal and more an external, structured way of expressing spirituality that has certain beliefs and dogma and creeds.
Right.
So that's a little bit different. And when we talk about spirituality, especially at end of life, it's very personal.
I like that individual and personal. That
right.
feels very true to that.
It can be very different for different people. And so part of it is figuring out what is it about the person who is dying that makes them feel connected.
Right.
The purpose and meaning. So.
All right. Well, good. I'm glad. Thank you to those of you who had a chance to answer that in this way. I know each of you has your own answer to that as well. Let's go ahead and the title of this presentation is "When Treatment Fails: Supporting Your Loved One During End-of-Life Care." I want to mention that if you have questions that you think of for Heidi during this presentation, you can go ahead and text those to that with that same setup we went over a minute ago, and they'll show up at the end. So if you think of a question 10 minutes in, go ahead and text that to Heidi, and then we'll look at all of the questions, including ones that you may share right at the end when the presentation concludes. And with that, I'll go ahead and turn the pointer over to you and let you drive. There we go.
Thanks.
All right, thank you.
So we already went ahead to our next slide, so we'll get started with this. And this is a little tongue-in-cheek on when you find out that treatment isn't working anymore. And as many of you probably have heard or experienced, treatment can be actually tougher than not having the treatment. So it's definitely a shift from when you're working towards actively trying to find a treatment that works to when treatment isn't doing what it's supposed to be doing anymore. And it's a shift. It's a shift for the patient and for the caregivers. And I think what happens at that point is kind of shifting, going to plan B. So, you always plan for the worst, hope for the best, And when it turns out that treatment isn't working anymore, what matters? What would be the two most important things to you kind of float to the top? Let's really get down to what matters at this point. For example, one family I worked with, if thinking about what concerns they had at this time, for the caregiver, for the spouse, it was, I know my loved one's going to die, and I don't know how to live without them. So that's one major concern. And then for the patient, the person whose treatment was no longer working, the major concern was, how am I going to die? Will I suffer? Will I be okay? I don't want to. So you can see automatically, important things rise to the top. So let me see how I move on here. So one of the important things when you get to this point is this is an illustration of kind of clearing the path. How do we remove those obstacles or any of those concerns to help our loved one make the transition out of this life and be as peaceful as possible as they transition on? And spirituality, as we talked about, is a crucial way of making that happen, because we get down to the meaning and purpose of what's important to that person and try to focus in there. The truth is that we are all going to die. It's universal. Whether we're sick or not, it will happen to all of us. Just like birth. Birth and death are both very intimate, deep times in life. And dying is deep work and mysterious work, and often a time of the sacred. So the transition for a patient between diagnosis and dying can often be a time of being in two worlds almost, 1 foot here and a 1 foot in another world of kind of where you're going. And being able to kind of stay open to that, there can also be tremendous grace that's happening. In other words, things falling into place, feeling supported in ways that you didn't experience or expect. Being open to that and things that are happening for you kind of out in the universe. The other thing about this time is most of us live on a much more superficial level. But when we get down to actually dying and end of life, it is a very deep time where all of the usual cares and worries kind of slip away. So just realizing that you are in this almost surreal time. And rich time, very deep time. So having said that, it's almost a time to take off your shoes, because this is a very sacred time to be on a journey with someone during this time in their lives. And this goes back many, many years. Even in medieval times, early rabbinic text said, this is one text, that one who visits the sick should not sit upon the bed or upon a chair or upon a stool, but should sit in front of the patient, for the divine presence rests above a sick person. So it just kind of gives you an example that this has been happening for the beginning of time. And for some religions, this can be a comfort. For example, in Jewish tradition, knowing that this has been happening for years can give some ease to know that you're part of a tremendous line tradition of where this is happening. So let's see. So another thing that happens when we are facing terminal illness, and even before that, when you are diagnosed, but certainly when it becomes terminal, is the patient, but also the caregivers, will go through grief. And I like this quote because many of us work in healthcare institutions, but we don't talk about grief very much. It remains pretty silent. And I think author and theologian C.S. Lewis said it really well when he said, "No one told me grief feels so much like fear." So being aware that there's a lot of fear that comes along with this time too. But the grief that I'm referring to is often coined anticipatory mourning by Therese Rando. And this is the grief that patients, but also caregivers, will go through during the terminal illness. Some of the main question is, who am I now? I used to be a person who went to work, or a person who wore shoes, or a person who had dreams of what I was going to do when I would retire. And now I'm not. So there's a process of kind of working through different losses. And you can see here loss of prior level of functioning, abilities, and maybe one of the biggest losses is the loss of dreams. And that can be especially for caregivers who had plans of being with this person later on in life. So sometimes being aware that this mourning is happening and just naming it can be helpful. So there are some tasks, I'm going to go ahead and put all these up, of the dying patient. You know, dying is hard work. There is work to it, and there's work for those of us who journey with these people. And I think we most often focus on the physical, you know, the suffering or the pain, which of course is very important. But it's also important to remember there's a lot more going on. This is why it's such hard work. There is so many levels of what's happening during this time. One of them, of course, being psychological, which we just talked about, loss of identities. You know, I used to be a person who went to work. Now I'm a person who has a hard time getting out of bed, maybe. Social can be many loss of relationships. You know, this is a time where people will turn inward and worldly matters become less important. So this is also a time where the present moment becomes really important. You know, what's going on right now for you. And then, of course, focusing on the spiritual, there's a quest for meaning that is just triggered during this time of kind of what is my life meant and what do I want to do with the time I have left. So one thing to mention is Ken Doka, who is a professor and hospice person, came up with 3 needs that become paramount when a person's terminal. And one of those, the first is to have lived a meaningful life. The second is to die an appropriate death. And the third is to find hope beyond the grave. So hope about after I die, you know, what will be my legacy? Is it something I can leave through my family or my grandchildren? Could it be through the work I've done? Or maybe it's transcendental, you know, it's in the spiritual realm. So it's kind of looking at your life and how I am now and what I want to do with the rest of it, the time I have left. And this slide just shows us that, you know, when patients are terminal, the spiritual needs really shoot up. Serious illness, like I said, definitely plays a role in jacking up our spiritual interests. And again, Christina Puchalski, who I mentioned before, has this quote about how prominent that becomes. So maybe the question would be, as if we're staying in the present moment, is what are your biggest concerns right now? And that can be part of like clearing that path that we talked about at the beginning, coming back to that question. And here's the definition I mentioned earlier that came out of that conference in 2009. And pretty much the people who wrote in nailed this seem to be pretty close to this definition. So it's really very open and very personal, like we said. Another area that is very close to spirituality is dignity, and working with people and dignity, and again, what's important to them becomes so crucial. And Harvey Chokanoff, who is an oncology psychiatrist in Canada, came up with this dignity therapy and dignity work that basically his question is, what do I need to know about you to give you the best care possible? And so that kind of steers a little bit away from spirituality, but they're really kind of parallel. And as you can see in this kind of quote, the dignity and the domain of spirituality are really interrelated. So I know for my father in my own journey, the biggest concern for him was not losing his dignity. So the primary caregiving became, how can we help him keep his dignity? And for him, that meant moving his hospital bed when he got home to a big picture window where he could see his bird feeders and birds and see his garden, and he could have his classical music playing. And so the very human aspects of himself were intact, even though he was losing control of other parts. And so these are some ways to look at, what is the meaning of my life? What has my life been? That dignity therapy down there is what I was talking about with Harvey Chokanoff, who's got great work, and you can Google him. But some of the ways to get at this is conversations about just reminiscing about one's life, just, a conversation, or a life review, kind of going through their life. Legacy work is a great way to promote spiritual well-being by talking to somebody about, what is it that you want to be remembered by? What do you want people to remember about you? Those who impact us live on in us. So in thinking about that and proposing that question, it's kind of like, what do you want your kids or your friends or your grandchildren to remember? And I worked with one gentleman who we'll see in a couple slides, who for him, he had a very close relationship with his granddaughter, who was about 8 years old, and he was very worried that she would forget him. So we did some work with birthday cards, and he filled out several birthday cards, her 21st birthday, her 18th. He wrote her a letter for when she graduates college, several things so that she would remember him. Unfinished business talks about, anything that's distressing for the patient. You might see spiritual distress, or, maybe it's a family member that they're not on good terms. Just kind of talking that out, even if they can't connect with that person, just even getting it out and maybe writing a letter to that person, anything, so that they're not kind of holding it in kind of to themselves or as a secret, and again, we want to clear the path. And let me just say, with all of these different ways of working with someone, it doesn't have to be intense, several sessions. I mean, this can be just a conversation to start getting things out. So keeping that in mind too. Certainly we'll in a minute talk about professional help. But this can just be conversations as well that can help people if they're feeling kind of stuck. Oops. Not sure. Here we go. So this is what's the meaning of my illness, similar to what we just looked at. This could be the biggest concern for someone who's got a terminal illness. What literally will happen to me, and how will my illness proceed? And those are questions, very legitimate questions, to ask your healthcare provider. It can help to not just have that unknown of what's going to happen. How will it be when I die? And a lot of patients are worried about their loved ones, and it can be helpful for them to actually literally do things that can help them ease their mind. For example, one patient I worked with, it really eased his mind to buy his wife a new car before he died. He was worried about her car. So even looking at, what are your concerns about your family and loved ones? The question about being a burden is so big as well, because you don't want people to just always feel like they have to be taking care of you. But one way of looking at that and kind of reframing that question is, wouldn't you be doing this for your loved one? So those are just some questions that might be going through someone's mind as well. And again, we talked about this already, but the need to kind of finish business. What's left undone that could be helpful? These are some sacraments and rituals that, many different ones, and even simple ones that you may not think about that can be helpful for spending time with someone you love who's facing the end of life. Frederick Buechner, who's a Presbyterian minister, says that a sacrament is the breaking through the sacred into the profane, or the everyday and the secular. A ritual is a sacrament to God offering His holiness to people. A ritual is people raising up the holiness of their humanity to God. So there's something about a ritual or a sacrament that kind of holds in place for us meaning and purpose, even through a simple act of having a meal together, or even lighting a candle and sitting with someone, or even a kiss, just to name a few. Storytelling certainly goes along with what we've talked about. Being in nature, people where nature is a big part of their spirituality, helping them to get out in nature or bringing nature to them can be a very meaningful thing to do. And then there's more formal sacraments like communion, taking communion, having a priest or a minister bring that, or closer towards the end of life, the sacrament of the sick. So scripture, psalms, singing is a big one. All of these can be ways of being together. This is the patient I mentioned earlier who was worried about his granddaughter. He gave me permission to show this picture, and we did a lot of work about his granddaughter, but his other concern, his two concerns, were his granddaughter. The second one was his partner here, Nancy, and they had been together for 24 years, and he really wanted to marry her before he died. So this is actually in the Children's Chapel at UNC Hospitals, and I officiated a very small ceremony for them before he got discharged. He was getting discharged that day, got dressed. Some of his doctors came, his surgeons, nurses. It was really quite lovely. So that's just an example of being kind of creative, too. You can get creative. So in all of that, kind of turning to the caregiver, it's important for us to acknowledge, this is deep, hard work. This is a mysterious, kind of surreal time where you can actually feel like you're watching a movie. Is this really happening? So paying attention to your own needs, and as we mentioned earlier, your own grief that you might be going through is really important to keep going. So whether you have a close friend you can talk to, maybe a minister or some support, or colleagues, it's important to find outlets and keep whatever is helpful for you, whether it's jogging or going for a walk with your dog, doing as many of those as you can to keep yourself strong. If we go think about the airline oxygen mask metaphor. We always hear that, apply the oxygen mask to yourself first before you do it to a child. It feels counterintuitive, but it really makes sense. We have to take care of ourselves to take care of others. And realizing in all of this, the two big gifts of grief and going through this deep time are wisdom and compassion. So you are gaining incredible amount of wisdom that you may not even be aware of yet, but you are becoming an enlarged version of yourself where you will use this throughout the rest of your life. And you're also increasing your capacity for compassion for down the road in helping others. You're learning things that other people don't know, and that's a lot going on there. So let's shift for a moment. We have about 20 minutes left, I think, and realize that, cultivating this non-anxious presence and mindful caregiving, that you don't have to do this work alone. There is services in the hospital and outside of the hospital that can help during this time. Two of them are palliative care. There's a palliative care service at UNC Hospital, and hospice, which is throughout our state. And they are not exactly the same thing. I think it's confusing sometimes in the hospital when the palliative care service is called that they are hospice. They work closely together, but they are not the same thing. So let's look at what is palliative care when we're talking about that. Palliative care is a service, and it's open to anyone who's chronically ill or having pain who's in the hospital at UNC. And, many healthcare institutions have a palliative care service. It's specialized medical care for people living with serious illness. And their main focus is relief from symptoms. So if someone's experienced tremendous pain, it's let's look at that and see what meds you're on and how we can make this alleviate some of your pain. And the stress that can accompany illness, and helping with goals of care or medical decision making. So, people get so many people in healthcare providers in and out of their room, giving them information that even medical people get confused. So for lay people, there's just so much going on that this team can actually help with medical decision making. And when they look at goals of care, they're going back to what we talked about. What's important to you? What are the two most important things for you with the rest of the time you have left? And lots of support. So you have an extra layer of support, medical support, social work, emotional support, and chaplaincy, spiritual support. And of course, their goal is to improve the quality of life for the patient and the family members. And again, it's not just for terminally ill, very end-of-life patients, but it's appropriate at any stage of kind of a chronic illness. So important distinction there that it's not just end of life. And this is Dame Cicely Saunders, who is the founder of hospice. So now we're going to move to hospice. And this is what she says. For her, it's all about quality of life, not quantity. And what's interesting is she got her nursing degree in 1944. She was thinking about this. And went back to her school in 1947, and 1950 started in this area and got her master's degree. And she is all about you matter because you are. You are till you take your last breath. And so let's look at some of the hospice basics. Just some of the bullet points here, you can read. But Medicare benefit Part A covers hospice. And the general requirement is a 6-month life expectancy or less if the disease would run its normal course. Now, there are people who have been fired from hospice, but that's not necessarily a bad thing. You can always get them back. But generally, we're looking at about a 6-month life expectancy. And now the focus is going to be what we talked about, quality of life, that meaning, what brings dignity, what brings personal worth to the patient. And so it's exclusively about comfort and quality. You do not have to, this does not mean the person gives up their primary doctor, and you can certainly go to the hospital. This is not something where, that's it, you can't go back to the hospital. And remember, if someone does go back to the hospital, you can pull in palliative care because they always work, not always, but often work together. And our palliative care service has an outpatient clinic as well. So some more hospice basics. This just kind of talks about reimbursement, and that here in North Carolina, Palmetto is the party that actually pays the hospices. And what I want to focus on here is the last bullet point. Hospice pays for all medications related to the primary diagnosis and associated conditions, not for unrelated conditions. But that's a big deal because that, obviously, those medicines can add up. So let's turn to the services that hospice offers. Doctor and nurses, nursing care, obviously, medical equipment, supplies. You can see the list here. For some reason, the right is a little bit smaller than the left, but it doesn't mean it's less important. One of the second bullet point there, grief and loss counseling for patients and their families. So there's social workers, there's a chaplain, at least one that's employed by hospice. And this is where you can get some of that help that I was talking about when working through what matters for someone at the end of life, if they want a life review, if they want to do some legacy work. Don't have to do it on your own. Hospice, they're trained to do this work and kind of work with a team approach. So even if you didn't ask for a chaplain, if someone else is in there, say from dietary, they may work with the interdisciplinary team and say, hey, this person looks like they maybe could use a little emotional and spiritual support. So you can see all the services that are offered here. I also want to just mention before I move on that very often 24/7 there's an on-call nurse or physician. So if in the middle of the night something is going on with your loved one at home, there's usually someone on call, so you don't have to make that trip to the emergency room, but rather kind of triage over the phone maybe what's going on, and if necessary, someone to come out. But you don't want to go to the emergency room, obviously, but try to cut that back as much as possible. And I will say with my own father, hospice was so impressive the last few days of his life. We didn't even have a chaplain, but the nurse was so wonderful and well trained in dealing with different concerns and needs of our family as well as my father. So there's a lot of crossover, I feel like, with the training with these hospice team members. One more thing they're trained in is the 5 Wishes document that comes out of the 5 Wishes Foundation. This is similar to the life review that we have been talking about, where they will work with someone on a form about what are the 5 most important wishes you would love if you could have anything, and writing those down and trying to, almost like a bucket list, what can we work through and get done for you, almost like make a wish for younger people. And even if they don't get crossed off the list, they're out there, they're written down, and you may be able to compromise on those. And where can a person receive hospice services? So this is, not, you want to check specifically on a certain place, but, there can be in-home hospice services, Hospice services can be offered at independent living and assisted living places, and also at skilled nursing facilities. So it's important to know that you don't just have to go home if there's nobody at home who can be a primary caregiver for the patient. It is important to note that Medicare does not pay for both hospice and an inpatient facility. They'll pay for one or the other. But those, can be worked out with a social worker and when you get down to that. There are also residential hospices. We have a couple here close by, and those are usually reserved for people who don't have a place to go with a family that's able to take care of them. So again, general criteria, we've kind of been through this, but the goal of treatment is relief of symptoms, not cures, quality of life, and making the most out of the time you have left. So this slide is basically saying to realize that in this very intense, mysterious time where it can be very confusing, there actually are more possibilities available than having to do this all on your own. You are not alone. So realizing that hospice is there, that you may have a support community through a church or a faith community, even if it's not yours. Don't forget about certain friends or neighbors who want to help, and take that help. There are also things in the community like perhaps a writing group that you could get out to if that's something you're interested in. And more places are opening up that have opportunities for caregivers, support for caregivers. So this is, I think, one of my last slides that's talking about, this is my father and I on a business trip many years ago. And this is just kind of a reminder that even though this is a very scary time and can be very sad, it's also a very rich time where deep connections and bonds can be made with a dying loved one. And one of the things we talked about was earlier is it's important for people to know at the end of life what is going to happen to them. And for my father, he wanted his ashes spread over Cape Cod Bay, which was a very special place for him for many years. And also, in Atul Gawande's book, Being Mortal, he grew up Hindu, and when his father faced cancer and died, his father wanted his ashes to be spread in the Ganges River in India. And so he brought his father's ashes there, where for him it was very meaningful, where thousands of people before him had had their ashes spread, knowing that many more people in the future would have their ashes spread, so that he was something bigger than himself. He's part of something that was bigger than his own story. So I think that I will stop there, Tim, and turn it back over to you.
All right, Heidi, thank you so much. There's so much there in what you've talked about, and I hope we'll have some questions.
Back to you.
Let me just go ahead and navigate to, and you do have references here, which our audience can go back and look at either through the slide deck or the video. Let's take a look and see if we have any questions yet. Oh, here we go. And just a reminder, if you haven't texted in a question or sent one via your computer, you can do that with the information above. So what options in North Carolina exist for putting your corpse to good use? Organ donation, medical research, green burial.
Yeah, that's a great question, Tim. I don't want to say an answer. I'm not an expert in this area.
Sure.
But this is certainly, for example, at our hospital, at UNC Hospitals, we have a decedent care service which deals with our patients after they die about green burial organ donation. Organ donation would be something you want to talk about before your loved one dies and have that set up. But that is something that you could talk to your healthcare providers about, and it might be different in different locations.
Sure.
So,
I have a question about transitions. So certainly any cancer diagnosis is heavily influenced by fears of death, and after that diagnosis is treatment and different outcomes with that treatment. Is there any special advice when a person is transitioning from hopeful for a cure to a diagnosis that is terminal and making that shift?
so let me see if I have yours.
Sure. I'm just imagining it's got to be a very and there's a lot that you've provided a lot of details on once one has made that shift or a family member's made that shift to a reconciliation of a terminal diagnosis. But in that transition from working towards a cure and either long term or otherwise, and that reconciliation that no longer is necessarily an option.
Yeah, so I would say that when you first get a diagnosis, you're going to probably go through some grief stages. Sure. That shock and denial that's happening, and shifting to, let's plan for the worst, but hope for the best, and look at all of our options.
Right.
And I would say get some support then for different resources available to help you.
Sure.
Work through that with professionals in that area. So, you might in the back of your mind have the worst case scenario, but there might be wonderful options. But it really is a journey. It's almost going from, the land of the healthy to the land of the sick.
Right.
And so realizing you're going from who I was to who I am now, which is the same person, but with different challenges. And that can shift throughout the whole trajectory of the illness. Sure. So.
All right, thank you.
You're welcome.
And I know we've got another question here. What is respite care?
So respite care is less about the curative care and more, again, about the quality care. Wanting to quality of life, comfort care, not necessarily like charging for the cure.
Okay.
So.
And how does that overlap with hospice?
Well, respite care is going to be taking care of symptoms, symptom management, and if you're in pain, and what can we do for you today that is going to bring you more comfort.
Okay. Let's see. Just a reminder again, you can go ahead and send those questions with the texting the letters UNCCN to 22333 one time, and then going ahead and texting in your question. We'll keep the lines open so to speak, for another minute or two here. I had a couple of other questions. Let's see. At the beginning, when we were talking about your bio, there was a mention of a Writing for Resilience program for patients, caregivers, and survivors. Can you tell us a little bit about that program, and then are there other programs like that throughout the state?
So that's a great point to bring up. So I was accompanying a colleague, actually, when she was going through breast cancer radiation. And when I was sitting in the waiting room for her every day, I noticed, you see the same people in the waiting room. And I thought, wow, wouldn't that be neat if there was something for these people to do, to connect them? And talked with a friend of mine who's a writing professional and coach, and we started co-facilitating a writing group called Writing for Caregivers. And we opened it up in the cancer hospital to caregivers of cancer patients. Well, what we found out, Tim, is that it wasn't just cancer caregivers, but it was also patients who wanted to write and staff. So we opened it up and call it Writing for Resilience. And what this is we have a prompt, whether it's a poem or a quote that we open with, and people just write whatever comes up for them about that prompt for 15 minutes or so. And then we're in a group and people can share what they wrote. And what we're finding is that you may hear parts of your story in someone else's story, which reduces, of course, isolation and loneliness of feeling like you're the only one who's gone through treatment or who is caregiving somebody who is got a terminal diagnosis.
Mm-hmm.
And so it's just a great way of reducing isolation and getting all that ruminating stuff out of your head onto the page. Sometimes people are surprised about what they write about and not even realizing what was going on kind of beneath the surface. We have a weekly group here at UNC Hospitals that meets Tuesday at noon, 12 to 1. All are welcome. No writing experience necessary. And I know some bookstores and libraries offer writing groups either once a month or on a Saturday morning. And that is another activity that maybe hospice would know about. If they don't know, they probably know who to ask to find out. Mm-hmm. But a great outlet for going through this kind of experience.
Thank you for mentioning that. And I was glad to hear you mention rumination. And of course, we know that rumination can be a source of depression.
Sure.
So it sounds like a very effective way to deal with some of that.
Absolutely.
All right. Any other questions? We'll take one more moment or so to look for any other questions that may come in. Oh, good. Great presentation.
You're welcome.
Thank you so much.
Thank you for listening and being here.
We always appreciate our audience. Thank you so much for being here. We hope that if you enjoyed this and other presentations in this series, that you'll let others know, direct them to our website at unccn.org. And we have, well over 150 lectures there now, both our Lunch and Learn series and professional series, now our community college series. We want to thank the state of North Carolina, the University Cancer Research Fund, for the funding that makes this all possible, and the UNC Lineberger Comprehensive Cancer Center. I want to personally thank Mary King and Alan Brown on our team for all the hard work they do to make these presentations possible. We are excited to have Dr. Evans with us on April 28th when Cancer Runs in Your Family. That will be our next Lunch and Learn on cancer topics, so we hope you'll be able to join us for that and future presentations. You can find information about all of our upcoming presentations at unccn.org. So we hope you'll visit us there. We hope you'll find us on Facebook, on Twitter, on YouTube, and call us or contact us via text or email with any questions, comments, etc. that you may have. Thank you so much for being here today, and we'll look for you next month. Thanks so much.